Welcome to the Let's Talk Health Forum. I'm Dr. Dan Pavlik Jr., where this show focuses on bringing the world of traditional medicine together with the world of alternative and holistic medicine to bring a more patient-centered approach, which creates better outcomes for that person. Today, we're not live in studio. Our team is actually out in the field to bring you a different perspective of the procedures that are performed. So we hope it's informative and we hope you enjoy.
Sarah, like many high schoolers these days, was a competitive athlete. But after 2 ACL tears, she wanted to try a different treatment option.
Well, thank you so much for doing this. Tell us a little bit about what happened.
So basically it happened my junior year of high school. I tore my ACL and I went to the doctors and they told me that I had a complete tear and that I would need to get surgery. So that's what we did after me and my mom talked about it a little bit. We ended up getting surgery, which what they don't tell you about getting surgery is that it never fully goes back to normal. So even now, on my knee, I have a numb spot just from all the nerve damage.
PRP injections are gaining popularity for a variety of sports injuries. PRP, or platelet-rich plasma therapy, utilizes the patient's own blood cells to stimulate cell reproduction and tissue regeneration. Injections guided by ultrasound are proving effective at treating joint injuries and assisting in recovery.
But after surgery, it took about 9 months to a year of full recovery with being consistent with physical therapy, and that was very painful too. But afterwards, my senior year of high school, I decided that I wanted to play lacrosse again because my knee felt like it was doing better. And then, so my senior year, I went back in. I was only able to play about 3 games, and then I tore my ACL again, that same knee.
The physical side, I feel comes a little more easily. The mental side is the side that I think requires the most coaching. Most of the athletes that we've had get hurt. It is getting them to play anywhere near where they were without the fear of doing the injury again or having the injury happen again is very high. So it's one of the hardest parts we have is trying to push them, but also positively, reinforce the fact that maybe they're, you can't say they're not going to get hurt again. You can't say that. It just can't happen. But the physically getting them to okay, take it slow today, even though, and we get it all the time, I'm fully cleared. I'm so afraid to do it again, or I'm afraid to plant, I'm afraid to turn, I'm afraid to do things. The physical side, I think that happens naturally with, help of ATs and doctors. The mental side is something that they struggle with, specifically with athletes we've seen. Both have been, actually all 3 have been knee injuries. Those are the biggest injuries we've had. And getting them to even want to get back on the field is hard because their heart is in it, but they are so afraid of getting injured again.
Before that happened, rewind the clocks back. What was life like for you?
Before I tore my ACL?
Before anything, before you broke that barrier, because a lot of athletes, once they hit that first major injury barrier, that everything kind of changes. But before that, you're like another person. So tell us a little bit about who that Sarah was.
Well, before that, I was super active. I was always either running outside or doing some type of lacrosse conditioning, just to stay in shape. Always super active. I loved going on runs, so I would always go on a run every day. Went to the gym and just stayed really active with lacrosse always. And then I feel after I got surgery, all that kind of just took a decline. I was very scared to run, and after surgery I wasn't able to run for a couple months. So it took me a while to even be able to run and be able to like know like how my knee is now. And it was still like, I don't know, like very tender. Even now, like my knee's still tender. I have still like some spots that are just like iffy.
How much time did you spend like with your sport? Like how much time were you on the field? How much time were you in training?
Well, practice was normally about 2.5 hours. And then we always had, like before lacrosse even started, we had like lacrosse conditioning. And that was always about like an hour and a half per day. And sometimes even after like lacrosse practice or even before lacrosse practice, me and my friends, we would like still be active, like playing lacrosse, doing different drills even before we had practice or conditioning.
This is actually one of the biggest things that they've started changing is by adding, you didn't weightlift when I went to school. Like you didn't add another sport to get better at your particular sport. And pushing dual sport athletes, but adding strength and conditioning to their repertoire of what they do as a, let's say, lacrosse player or a basketball player is something we just didn't do 20 years ago. And by adding that next aspect, they're getting different muscles built and strength. And because when they hit college, they're going to be in the weight room 4 or 5 times a week on top of their practices. So this is something that they've started to do. We have our weightlifting coach has been like, give me your athletes. We're a winter sport, you're a spring sport, give me them. And I have girls who are stronger than they've ever been, which translated to lacrosse for us because now they're stronger on the field, they're faster on the field. They understand their bodies a little bit more because they were using different muscles and different, just a different field in general.
Tell us about that day. So you're back in, were you in a game?
The second time I tore my ACL?
Yeah.
Yeah, so it was just a normal game, but this time, so the first time I tore my ACL, it was non-contact. My cleat just got stuck in like the turf and then shifted the wrong way, tore my ACL. But this time, a girl pushed me, and then I heard a pop in my knee, so I was super scared, and then all of a sudden, like, my knee started swelling. And then we went to the doctor, and then they told me that I tore my ACL, but this time it wasn't a full tear, it was just a little over 50%.
So after you tore your ACL the second time, tell us a little bit about how that went.
So that one, I didn't have a complete tear. It was just a little over 50%. And we saw that from the MRI. And then after that, I was kind of just wearing like a generic knee brace for a little bit. And then we went to the doctor and he told me that I needed to get surgery and that would be my only option. But I knew that I did not want to go through that pain again in that long process, not to mention it's super expensive to get surgery. So we started talking and I heard about PRP. And so we decided that we're just going to try PRP, see how it works. And if it doesn't work, then worst case scenario, I'll have to get surgery again.
What percentage of athletes are going into surgery and recovery these days that, from your perspective, you feel like they've got a back to play plan?
If it happens at school, every one of our athletes, as long as it happened on our school campus. And the only other time that may be a concern or issue is if it's happening during the summertime where we're not here. Between our athletic trainers, they can come in for physical therapy and do that at the school. And then same thing for practices for us. Like the kids are going to attend practice, and then usually they're doing their physical therapy plan at the practice. So I would say majority. I don't want to give a certain number. I don't know that number percentage-wise. But if it's happening at school and it's one of the programs that our school can help run, we have the items to, whether it be STEM or whether it be the bands or weights. If it's happening during school and they're willing to put in the time and effort during their lunch periods, that physical therapy can be done on campus.
What was physical therapy like for you? Like, what was it like? Like, what did they tell you at this point in time? Where was your head? Are you like, how am I when do I get back to play? What's my buildup for this? Like, what were you thinking as you're out of the surgery, you're dealing with the pain, but now how do I get back to my game? Is that what you were thinking, or what were you thinking?
Yeah, I knew that I wanted to play lacrosse again. So no matter what, I was making sure that I was doing all the exercises they told me going to physical therapy, that was only like an hour a day, and then like every single day. And then after like a couple months, we only did physical therapy like 3 times a week, and then we started like getting lower and lower. But they told me that like I needed to keep up with some exercises even at home, what like just random things, whether it's like go on like a walk or like start to maybe jog a little, or just do like knee strengthening exercises that I can just do at home. And that's like what I made sure to do, because I knew I had a long way to go to fully, if I wanted to recover my knee right.
9 months, right? It took you like 9 months before you were back.
Around 9 months, yeah.
How do you feel like these kinds of injuries affect their academics?
Specifically, injuries that require surgery or something along those lines. Academics do struggle because surgery is not a day in one day out, back in, no matter what. Even if it's a 1-day surgery, in and out, recovery time, are they going to be able to get up and be mobile? What does that look like? And in my experience, it's been 2 to 3 weeks before they're back into academics. But then you hit that mental, whether, are they motivated? Some of our kids' only reason, and I was one of those kids, my only reason to go to school was so I could play sports. The only reason I went to college is because I played a sport. So for us, and everyone's a little bit different, but that plays a huge part in academics, especially if, let's say, they were a college-bound athlete looking to play in college. That injury maybe takes away that option or a scholarship they had, and those motivations start to decline, and their goals and aspirations start to decline. So we see, probably not to the extent, because our girls are quite elite in the classroom, but I would say there's a significant decline for almost any kid when they get injured, whether it be motivation to do better or to stick with it, but also just the time out. There's not really an easy way to take off of school. Like, you go home for 3 weeks, for 2 weeks, there's no magic recording anymore with COVID out to like watch what happened in class. And teachers are accessible via email, but it's hard to explain things via email.
So how did you transition from the world that you'd already been through with surgery into PRP? What changed? What was different?
Honestly, PRP is nothing compared to having to go through surgery. PRP, it only took 6 weeks, rather than surgery is like 9 months to a year of like full like pain and trying to get back to normal. But PRP for me, I believe, was just so much better, because I was still able to do like my exercises and able to do everything like that I would do in my like daily activities, but just once every 2 weeks would just get an injection. And then we waited a few months after that last injection, and then got another MRI, and then found out that I was healed again, and it was like magic.
What was that process like, going through PRP? I know you said you just would go in and get injections, but what was it like for you mentally going through that process? Did you think it was happening? Did you think it was working? Were there indications that it was working? What was going through your head as you were going through all of that?
Honestly, I was a little skeptical on PRP, just because my tear was over 50%. It wasn't like I just had a small tear. So I was kind of skeptical on like if it was actually going to work, or if it was going to work like a little bit. For me, what was super nice is they numb you. They like numb your area before. The needle, the needle hurts a little bit, but not, like, it only lasts like 30 seconds, if that. So it's not bad at all. I didn't notice anything different in my knee, I felt like, when I was going through PRP, because that's why I was so shocked, like, afterwards when we got the MRI, when they were like, oh, like, your knee is fully healed now. I just, like, I couldn't believe it. Because for me, everything just still, like, felt the same, to be honest.
I would say majority of our athletes, when they get injured, are ready to go on sideline. They're ready to sit and watch and cheer on their teammates. It's one of those things that I think that player has to have a connection with the team with. The team's overall for girls lacrosse specifically, they are embracing and very helpful. How can we help? What can we do? Off the field, but on the field, we just hope that that person is like our best cheerleader. In multiple cases, it's been captains for us who've gotten injured, and they have to sit out and watch their teams, support, and they're ready. They're on the sidelines yelling and screaming, ready to, not be there physically, but emotionally and mentally and support. And if they're a captain, they're probably some of our either best athletes or best IQ, and they're ready to be like, okay, we saw this. And it's kind of cool because I think it gets them in the mindset of like maybe potentially coaching, because they're on the outside for so much that they can, oh, coach, this is what you've been saying. I'm like, yeah, I've been saying that for 4 years.
What was it like back to play? Like, what was that period like for you?
Honestly, I was so scared to go back to play lacrosse because, so when I first got the surgery, I knew like I wanted to go back, I wanted to play, but then towards the end of physical therapy, I started like doubting myself, like, is it really worth it to play my senior year? Like, should I do it? Like, what if I tear it again and have to get surgery and go through that pain again? So I was kind of skeptical, but eventually I decided to go back and play. But even then, I was like super scared. I made sure to wear this knee brace that they made for me. So I wore that during like practices or like anytime I was running, just like during the game, whatever. And then I even made sure to wear a knee brace on my left knee just in case, because in my head I was like, oh my gosh, if I tore my ACL once, like what if I do the same thing in the game and then I tear it again? So I was just like always like very cautious.
So tell us a little bit about what Sarah's like now after all of this.
Good. I'm able to finally run again. I've started to get back into running. I still do those knee exercises just to like keep up like the strength. I'm definitely not as, like active, I feel like, as I was, because I'm not playing a sport anymore. And I guess still in the back of my mind, I'm like a little scared if I do something, like I could tear my ACL, just because what I went through like with surgery, like just really just like messed with my head, because now I feel like I'm just like so like nervous. I'm just like cautious, but I'm still able to do mostly everything. I don't wear a knee brace anymore. I'm fine to walk on my own, run, do any like exercise with machines at the gym or whatnot.